Hi, welcome to your checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited you were able to join us here again today. So if you want to hear more about what's going on in our lives and a little ditty about fun, stick around for the next 5 minutes or so. But if you are interested in getting right to the topic, maybe you skip ahead, find a chapter marker, or somewhere between 5 and 10 minutes is when we'll start talking about the content of interest. But we do have to tell you about our beverages that we had yesterday and the experience that we had next to us. What beverages did we get?
We got extra dirty Grey Goose dirty martinis with blue cheese olives, and they were delicious. I took like 2 sips of mine. I'm doing this I'm like a headache girly, and I'm finding that there are a lot of things that trigger a headache. One of them is alcohol. And
Womp.
Then I have a headache that lasts for like 4 to 5 days, which some might call a migraine. And
some might call a migraine.
Yeah, I've done everything except go for my neurology follow-up. So, however, things seem to be better. Anyway, so I just needed to get a little taste of the good nectar. That was a really good dirty martini. But then you finished it and I ate the olives.
Yeah, well, and I use you as a reference because my palate is not so sophisticated that sometimes I can't tell what is good and what is not good. And knowing that that is right down the street, that is an excellent little tidbit to add to our neighborhood thing. Speaking of neighborhood, what about the people that were sitting next to us? They had a wild dining experience.
Yeah, that was so annoying. We were sitting next to these 2 girls who were there before we got there. And the one girl, not the one that was next to you, the one next to that girl.
Yeah.
Was so rude to the waitress. So we were sitting at the bar, and then there are certain staff that are serving the bar. So it wasn't we were at the bar, but we were on the oyster section. So it wasn't a bartender was right there. So
yeah, with Larry the Lobster staring at us while he's grooving in the ice.
Yeah. And the one girl was so rude. It was the girl that came to take our order, was so rude to her.
Yeah.
Which I right off the bat, that was 30 seconds into us being there. And I just personally think if you are rude to wait staff, you're just the lowest form of a human. And it's
yeah,
the worst.
What are you doing?
Why are you being like this? Someone's bringing you your food and your drink and accommodating you. Just be polite to them. Where's your mother? Where's the farm you were raised on? Whatever.
Lowest bar you can hit.
Yeah. And then she, so she ordered oysters Rockefeller, and then she's telling her friend, she's I think I'm gonna get however many raw oysters. And she's okay. So then the waitress comes back. She's rude to her again because she just wasn't articulating. She was just speaking things at her that didn't make sense. So she was rude to her again, whatever. Comes back. And then I think the other, her other coworkers were okay, we'll switch out. Cause then another girl came and another random guy came and whatever. And they were switching out. And then, so she gets her raw oysters and then she eats half of them. Mm-hmm. And then she tells her friend, I don't really want the rest of these. I'm going to send these back and get some more oysters Rockefeller. And I'm just sitting there. I'm that's not how it works. This is obviously your first time in a restaurant before, but okay. So then she asked, and they were also, another thing she was doing was just flagging down any staff member who clearly wasn't their waitress or anyone who they had seen before. She just
someone could nonchalantly be passing
by.
Or
it was one of the busboy people or the barbacks or someone who didn't have on the server uniform. And so she flags down this guy and asks, can I send these back and get whatever? And he's I don't know who you are. Also, this probably isn't my job. He's I guess I'll go ask. So then I guess it was one of the managers because he had regular clothes on. She asked I want to send these back because I want something else. And he's okay, you can't do that. You ate half of them. You can't. Half of them. It's not it came out and something was wrong with it or we brought you the wrong thing. And that's different to send something back, which I also feel is whatever.
Sure.
That's another thing.
It kind of went over the threshold.
Yeah. ate half of it.
Yeah.
You kept eating it. So like you didn't not like it, whatever.
Yeah.
So he's like, I'm pretty sure she was trying to just like get away with like that part of the bill. But then the manager guy was like, I mean, you can order more of something, and like, I'll take this from you, but this isn't like a send back. You can order something else in addition to.
Like you're entitled to not like something, but like
you don't like get to not pay for it or like send it back because
like you made a mistake.
Yeah. So that was that. And then these two girls were like FaceTiming someone the entire time.
Which was kind of distracting for our experience.
Which was
a little
like
bit. Yeah.
Annoying. Also, like, why didn't you just invite this person?
Fair.
You could have talked in person.
Could have invited them.
It was so annoying.
Yeah. And they lingered longer than we were there. And as we transitioned our evening to home, came back, fed Ollie, and then we started walking to, there's a place where you can go and get beers, bring them home, a little more like niche environment. And we are walking down the street and all of a sudden we hear this guy yelling, help, help. And then we see this little puppy.
Oh, it was so cute.
Who is just zigzagging out of the street, around cars. And the way that people came together to stop traffic. One woman got out there and she was like Moses and she just put her arm up and she was like
parting the Red Sea.
She was like, stop.
And she like, for some reason, like, because we like saw that and he's like, oh my God, the puppy. And then I saw this little, like tiny little puppy, like clearly not like trained or like doesn't know like any commands or anything. Like it was like a really young puppy. Got out, I guess. And this guy, it was like, I don't know what kind of puppy it was. I think it was a like mini golden doodle or something like that. And I was telling Eddie, I was like, I'm pretty sure this had to have been like his like girlfriend's dog or something. Cause I'm like, not to be that person, but like no guy, like a guy like him is not going to have like this little tiny dog.
Fair. Yeah.
There wasn't like a female influence. Oh yeah. So then like we saw it. I don't know. I just like blindly started walking in the middle of the street because for some reason, like this woman in the middle of like, I just felt safe with her. She meant business. And I was like, no one's going to drive. I'm safe in the middle of the street.
Yeah. So traffic was stopped. A gaggle of people came around and kind of cornered the puppy.
Everyone was like circling the dog.
And then eventually like the puppy darted back into the guy's arms and he just sat there and like his underwear was not white anymore. He like, there was so much secondhand stress that like, that was, what a beautiful moment to know that ended well, but that was a really intense thing to witness. Yeah. And it had a happy ending, which I was really happy about because that would have been devastating to see it otherwise.
Oh my God. Yeah.
Which we don't have to think about because it didn't happen. All right. So what are we going to talk about today, Nick?
Well, today we're talking more about weight loss drugs, but specifically about the compounding pharmacies and all of that.
Yeah.
Right?
Absolutely.
Okay.
And a little bit about...
I didn't fully read the outline yet.
And a little bit about how in response to shortages and the rise of compounding pharmacies, which we will explain, how the drug companies are responding in their own way in a kind of interesting way that actually directly impacts patients. Of course, we've talked in this show on prior episodes that there is an extremely high demand for these GLP-1 receptor agonists, weekly injectable medicines like FDA-approved drugs like Wegovy, which come in pre-filled pens for weekly dosing, or Ozempic, which has multi-dose pre-filled pens for dosing, or the oral cousin Ribelsis, which is the same medicine semaglutide in oral form. There's also Zepbound, which is a tirzepatide-based component specifically put in the weight loss bucket that has two active ingredients, a GIP and GLP receptor agonist. And again, it's indicated for adults who have obesity or who are overweight and have at least one weight-related medical problem. And it's also FDA approved for moderate to severe obstructive sleep apnea and people who have obesity. And so because they're so effective at what they do treating obesity, there is an incredibly high demand. And I think everyone saw this come about, is that like everyone who was on these medicines was having a tough time getting these medicines. And so the impetus for this episode was to discuss the response to that demand, which was the rise of compounding pharmacies.
Tell us a little more about how we got here with needing to compound these medications?
Yeah. So like we were talking about, because of this extremely high demand, there was a supply constraint placed on many of the FDA-approved products. And so to circumvent that, people started going to get the medicine other ways in compounded versions. And so I think it's important that we define our terms. So drug compounding is the process of combining, mixing, or altering ingredients to create a medication tailored to an individual person's needs. Now, this is not a new concept. This has been around. I think you have the most experience between the two of us with these meds.
Yeah, compounding pharmacies are not like a new thing since all of these weight loss meds. I mean, it's probably a new thing that kind of like the general public is now more familiar with, but any med, kind of variation can be compounded. It's just the way that the medication is made in the pharmacy. More often, some of like the more specialty meds outside of like the weight loss meds, the more specialty meds that you can't get at just like a regular commercial retail pharmacy, or if they have to be made a certain way, because like a Walgreens can't compound a med and they can't, they don't have the whatever you need, the particulars to compound it. Or if you need like a medication in a liquid form, but maybe it doesn't come in a liquid form already, they can like do that at a compounding pharmacy and, things like that.
Gotcha. Are there any meds that like you are aware of that?
I mean, all of like the weird meds. I know like omeprazole is a big one in peds.
Okay.
That doesn't like come in a liquid right off the bat.
Yes.
Yeah, and it has to go to like a compounding pharmacy. And like specifically if it's, like a kid can't swallow a pill, or maybe they're older but they have like a feeding tube or something,
Sure.
It needs to be liquid. That's like the first one right off the top of my head.
And so really we want to emphasize that while really useful and they certainly serve a purpose, compounding pharmacies and compounded drugs, moreover, specifically don't undergo the FDA pre-market review for safety, quality, or effectiveness in comparison to FDA-approved drugs. Truly, like a compounded drug should ideally only be used when a patient's specific medical needs cannot be met by available FDA-approved drugs. Mm-hmm. So pretty reasonably here, you listed off a great example right there, an infant who can't swallow a pill and it's not readily available at a Walgreens. Boom, great reason to have a compounded version of that that's liquid. So when there was this shortage of semaglutide and tirzepatide-based medications for weight loss, then people started to go to compounding pharmacies, which is more often what you're seeing on TV when you're being advertised by like direct-to-consumer marketing for these specific weight loss medicines. So something to note is that the FDA is aware of compounded semaglutide, because I'm not seeing anything active about compounded tirzepatide at this point, but they are aware of compounded semaglutide products that are being marketed for weight loss. And for a period of time, it was reasonable because they're like a reasonable avenue to go because it wasn't FDA approved, because it wasn't available in the market. So, we found that these medications have a certain place in peds, adult care, specialty care. But now for something so common, such as obesity, a lot more people are looking for this medicine and have reached out to compounding pharmacies to satisfy that need. But this isn't perfect. There's actually some negative downside to this. So what are we seeing out there that's a little troublesome?
We're seeing a lot of errors in dosing. It seems that people are giving themselves too much of the medication.
And so when someone gives themselves too much of the medication, there are adverse events that can happen, some requiring hospitalization. And so, like you said, some of these are coming from dosing errors. But, I mean, this isn't the clearest thing in the world, it seems. There's a lot of different experiences that a patient may have. There's confusion that can come up. A lot of these are people are getting from online doctors as well. Like, I'm not seeing a lot of people who are seeing patients face to face saying like, yes, go to this compounding pharmacy and get your medication, because something we're seeing is that people are getting advice to give themselves X amount of maybe a milliliter or maybe a milligram or maybe a unit. And I would say that that's pretty confusing, especially for someone who hasn't done an injection before.
Yeah. But you should also be receiving the correct syringes, which can potentially also be another issue.
Totally, right?
Like 1 unit and 1 ml is a lot.
But is a unit an ml?
No.
Right. And not everything is like 1 milliliter is 1 milligram either.
Mm-hmm.
So that opens up like a whole world of confusion. And so when people are overdosing in this way, they are getting the nausea, vomiting, increased risk for pancreatitis. And something that's really disturbing is that the half-life of this medicine is 1 week. And that's why you dose the medicine every week. A half-life is how long it takes for a drug to leave the body. And so if you have too much, this will stick around. And so you may not be able to eat, may not be able to drink, and lingers as an issue.
I think it's important also to note that you should always check what the label on whatever medication it is and for whatever the concentration is, because that might be something different than what your doctor is telling you, because like the pharmacy might just carry a different prescription of something, or it might be a different prescription, a different concentration of something.
Right.
So your pharmacy might carry something that's like higher or lower concentration per, 1 pill or 1 ml or 1 unit of whatever you're getting.
Yeah.
So like your doctor might tell you take 2 milligrams of something.
Mm-hmm.
And then it might even say like, I don't know if it's like a liquid or an injection, like 2 milligrams or 1 unit. But then if you get it from a compounding pharmacy where that might be a little bit different, and then your bottle says, maybe it's 2 units or whatever.
Yeah.
It might just be different, but like always go by what the bottle says, not necessarily what the, your discharge paperwork or like whatever your doctor kind of mentioned to you.
Absolutely. And like this is something to slow down and pay attention to, because especially when it comes to liquids and concentrations, it's so easy to make a mistake.
Yeah.
Especially when, like you mentioned, syringes earlier. Like syringes come in all different shapes and sizes. Maybe not all shapes, but they come in different sizes, maybe different diameters, and requiring different amounts to be drawn up. Like 1 milliliter in a really tiny syringe may look very different to like 1 milliliter
like
may
5
fill up
ml, yeah.
the whole thing, whereas in a 5 ml syringe, it fills up 20% of it, which is totally different. And then like you were saying, like where your doctor may tell you take 10 milligrams, but the concentration of the liquid is 5 milligrams per milliliter.
Yeah.
Like you have to sit down and do that math and say like how much.
Yeah. I mean, you shouldn't have to do the math because it should be on the label on the bottle, but I don't know.
It should. I don't know. Well, I was even seeing a guy this last week. He was like doing every 2-week injections of testosterone, and he was having a tough time actually drawing up the very specific amount of liquid to get the exact dose that he needed. So like that's a whole other community of people out there who this affects. So it's just something very much to be aware of, that like milliliters are not necessarily milligrams and are certainly not necessarily units. And you have to take special attention to the size of the syringe and the concentration of the medicine that you're getting. So one other thing that I think we should bring up is that these pens that people are getting, like the once injectable, make it very, very simple pens from the Wegovy and the tirzepatide, the Zepbound. Usually the compounding pharmacies aren't giving you a pen.
Yeah, no. Because, it's like the pen that's the expensive part to make, not the actual drug.
Exactly.
Which is really annoying, actually.
It is. No, yeah. And then we're going to...
It's such a coincidence that all those drugs that come in a pen are expensive.
And we're going to dive into that in the back half of the episode, where like how these drug companies are making it more affordable, quote unquote, more affordable. But you kind of have to learn how to do the injection yourself in a syringe and a needle, not with the pen. So that's a whole other skill that perhaps you weren't used to before. but like there's tons of videos out there about how to do the pen self-injection, but it's not as easy to do the needle injection with the syringe. So just a couple stories that the FDA did put out about errors in dose management, just to put this into perspective. Most of the errors came up in people like mistakenly drawing up more than the prescribed dose of multiple dose vials. So like you get something and you have to actually pull up the medicine. And during these self-administration episodes, people were administering 5 to 20 times the intended dose of the medicine. And like you said earlier, like some reports were patients were told to use 100 unit insulin syringes for very small doses, and instead they were like administering 50 units instead of 5. Or maybe it was like a quick interaction and the prescriber was like, oh yeah, do this real quick. And then like there was an error there. So like it's not all on the patient. It might be from the provider as well. Or maybe a decimal point isn't in the right spot. So instead of taking, 0.25 milligrams, you're taking 25 units or something like that. So it can get very confusing. So aside from any of the changes or difficulty in dosing, compounding pharmacies sometimes have different ingredients and different forms of the medication that are also not FDA approved. So some compounders actually have ingredients like vitamin B12, B6, L-carnitine, and NAD to their semaglutide products.
People love NAD nowadays.
It's like such a niche biochem thing of like the electron transport chain, I guess. Sure. A real nerd in the wow, that was a deep cut right there. Are you hearing about this? Like people are like searching like
NAD? Oh yeah, people go places to like get these like infusions.
I was getting this and learning this from like making this episode, but
really?
But you're seeing that people are like,
oh yeah, it's like a thing.
I want my semaglutide with my B12.
Mm-hmm. I know a lot of people get B12 with that. They'll like get both. I haven't heard like the NAD being mixed in with it. I just know that's like a separate thing. People like go for their NAD infusions and like B12 shot.
Right.
Apparently it's the fountain of youth.
So while these aren't looked at for safety and effectiveness.
Yeah, so don't take my word for it, but that's just what the people are doing.
Right. And so like this is something that's out there that people are doing and it's unestablished. And so that's one of the important things. We are kind of bound by evidence-based medicine. And so this isn't looked at. And so we don't know. And one usually operates in the realm of like, if we don't know, it's probably not safe. Some compounders may also use salt forms of semaglutide, like semaglutide sodium or semaglutide acetate. And these are actually different than the active ingredients in the base form in the approved drugs. And these like don't necessarily fall under any sort of like FDA conditions for compounding. And so just adds to a lot of confusion in this market altogether. So really you just have to be careful because if you inject with the wrong amount of medicine, this can lead to some really bad side effects like nausea, vomiting, abdominal pain, headache, migraine, and some people have required hospitalization. And these symptoms or side effects don't go away immediately because the medication lasts for a long time. And the FDA is looking out for stuff like this. So because of all of the hoopla with compounding pharmacies and how expensive these medicines are, and you kind of teased at this earlier, pharmaceutical companies have responded. Specifically, Eli Lilly and Novo Nordisk have responded and offered direct-to-consumer models for people to be able to access the FDA-approved versions of these medications.
All right, Eddie. Tell us about this direct-to-consumer model that's out there.
So if someone didn't know, Eli Lilly, we'll talk about Zepbound first. Eli Lilly has a self-pay journey program is what it's called. It's from the Lilly Direct Self-Pay Pharmacy Solutions. And for a while, they were offering reduced prices of Zepbound for the 2.5 milligram and 5 milligram vials. So that's specifically different than the injector pen. And so they were able to bring down the cost of production because now they're only producing the drug, not the drug and the auto self-injector pen, which, like you said earlier, turns out to be the really expensive thing. Mm-hmm. And so this model that they have aims to provide transparent pricing by removing third-party supply chain entities. And so now altogether, through their direct-to-consumer system that they have vial options where you draw up the medicine and you give it to yourself, but it's an FDA-approved drug of 2.5, 5, 7.5, and 10 milligrams. The 7.5 and 10 milligram doses were just recently added, and while the 2.5 and 5 milligram ones were there all the while since the initiation of the program. So understanding that, you're only missing the 12.5 and 15 milligram doses, which people use, but they may not be as common. And so for pricing wise, you can find this on their website, and we're recording this episode Sunday, March 30th. But as it's currently written, the Zepbound self-pay journey program offers 7.5 and 10 milligram vials for $4.99 a month for the first refills within 45 days or so. And so $4.99 a month is admittedly still a very high number, but to compare, that is against the over $1,000 per month that these medicines cost in the pen. The 2.5 and 5 milligrams are more affordable. The data from at least February 25th, 2025 suggests that the 2.5 milligram dose is $349 per month, and 5 milligrams is $499 per month, like the other ones. I thought this was a pretty cool thing when I found this initially, because a lot of people may want this medication, but their insurance companies may not pay for it. And that's been one of the most frustrating things. You got nothing for me, huh? And so we talked about how Zepbound has this new program. Novo Nordisk just came out with their program for Wegovy through their NovaCare pharmacy, and they offer a direct-to-patient delivery option for actually all of the FDA-approved doses from 0.25 all the way up to 2.4 milligrams. Their price is quote-unquote reduced at $4.99 per month for cash-paying patients, and the key piece to this is that Novo Nordisk is offering this in the single-dose pens compared to Zepbound, which is being offered in syringes. And so that might be their little niche of offering hey, we're doing this, but we're still doing this with the pens. We just wanted to relay all of that information to you, knowing that some of these are updates and a changing environment. FDA approval is really important in this whole thing, and that knowing that Zepbound and Wegovy now may be available through these direct programs, albeit still very expensive, at least they've undergone rigorous review for safety, quality, and effectiveness, and really reflect about where you're getting your medicines as we kind of think back to our conversation about compounding pharmacies. And at the end of the day, make sure you always talk to your healthcare provider for any further advice that's specific to you. So thank you for coming back to another episode of Your Checkup. Hopefully you were able to learn something for yourself, a loved one, or
a neighbor.
Please check out our website, send us some fan mail. Please rate and review the show if you don't mind. Perhaps leave a comment where you're listening. Any of that support would be greatly appreciated. And until next time, stay healthy, my friends. I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.